First meeting, there was basically the department head of every outpatient clinic, whatever. I said, for this first meeting, if I'm a new patient walking into your clinic, I want you to bring me a copy of every piece of paper that you hand them at that first meeting. I had a stack like this tall of paper. So we went and started laying them all out, trying to match them up. When we got done, I had 4 different consent forms. We only have 1 in the organization, but we had 4 being used.
Welcome to Unjargoned, a podcast about healthcare workflows that make sense and without all the acronyms. We talk to people on the front lines of healthcare and explore cool workflows they're using to solve real problems. And today, we're joined by Roger Neal, VP and COO at Duncan Regional Hospital, one of the most innovative health systems out there. Recognized by Newsweek as one of the best hospitals, Duncan's known for pairing innovation with really strong culture that puts people first. Our guest has been with Duncan since 2001, leading operations and technology strategy, even earning the hospital recognition as Most Wired year after year. And to top it off, he's been named one of Computer World's top 100 IT leaders. We're excited to talk with Roger about leading change in rural healthcare, building a strong culture, and what really takes to innovate where it matters most. Roger, welcome to the show.
Thank you. Thanks for having me. That sounded so cool. I wish it was like that actually in the building.
We're psyched. Your background is pretty phenomenal. Do you want to maybe just to start things off, take us back a bit? How did you end up doing what you're doing? Okay, Cirque du Soleil for a minute, because that's gonna be its own special little topic. But kind of take us through how you ended up at Duncan and what's the keeps you getting up every morning to do this really hard job, but it's the most important job.
Sure. So, I think, I think as a kid, I always knew I wanted to be in healthcare. I think for a lot of us, there is that little pizza inside where you want to find something to help other people, right? That kind of feels like in your soul that that's your calling. And so for me, really, really early on, even though I was, as a kid, I was involved in every sport known to man. I had the opportunity to do lots of different things, through high school and into college. But there was always that, hey, this is not what you really need to do. You're really supposed to be in healthcare. And so I really started out kind of coming out of that I really wanted to go into physical therapy. And so so that was kind of the driving force, right? I wanted to be a PT. I wanted to help people through whatever issues they were having. That was kind of the drive. Well, in Oklahoma, there are only 2 PT schools, and each of them, when I went through, 3 years ago when I went through college, they had a cap,
Solid.
and so every program was capped, and so across the entire state there were only like 70 spots, and 70 spots, and you've got 700 applicants, every year, but they had a pretty rigorous process to get in. Well, I didn't get in the first time, and so obviously disappointed, like we all are when things don't go exactly right. I decided, well, maybe that's not what I'm supposed to do. Maybe I'm supposed to be a doctor. And so I continued on. I was in a pre-med program at the University of Oklahoma, did, kind of all the way up to the end. And going through that process, my senior year at college, I got involved in kind of the IT side and really through kind of a psychology lab. And so we were doing a huge experiment with the FAA. And so I got to do a lot of techie stuff, setting up computers, doing all kinds of stuff. And there was just this process in my brain. I could see things and I could solve problems or see kind of the train wrecks coming as we were doing things.
Yeah.
I could just see those. And so the technology part of that really just fit. So at that point, I kind of decided, hey, I don't know that even being a doctor is really what I need to do. I think I need to be in operations. And so that is kind of that's how I kind of ping pong through to get to where I am. Is life like it does kind of ping pong me into getting into healthcare IT. And then, once you get into IT, and get started, you literally learn potentially everything about the organization, how the business works. I mean, there are no dark corners, right, that IT doesn't invade in a hospital. So through that, and still with that kind of ability to be able to see hey, this is the picture. How do we solve it and be able to put that together? I was able to kind of move up over the years. I've moved up from IT to director to, VP of multiple crazy things to, the COO role.
I've been dying to ask because you keep dropping Circus Soleil this, Circus Soleil that, and we didn't even get into it. That was my favorite thing we talked about before. So, Roger, you need to do that again. Like, go through how you started there and how your experience impacted your life now in healthcare, because I'm sure a lot of that overlaps.
Sure, it does. So, so I was in healthcare. I was out of college, got into healthcare, was in healthcare about 5 years. I started out as really just kind of a PC trainer,
Mm.
moved up in a really, in another rural facility, moved up kind of into networking, put in the first network, the true network there that we think of today, just because of, the way all of our jobs work. The director of IT there left and I went to another facility. I moved up to the director of IT. At the same time, I thought, if I'm going to do this for a living, I should probably have some kind of IT degree. So I went back and got my master's degree. And once I finished that, there were some changes in the hospital. And so my wife and I were like, well, we've been here 7 years. Maybe we just need to look. And so, we were just out there at the time, Monster. Some of your viewers may not even know what that is, but
I know what that is.
Out there, right? Monster.com. So I got on Monster and started looking around when this job popped up, from Cirque du Soleil, IT director in Las Vegas. And I thought, we read through it. I thought, that'd be really cool. It's Cirque du Soleil. Come on. So I applied and didn't think about it. And so literally 5 months later, I get this phone call. I'm driving home one day and I get this phone call and it's Cirque du Soleil. They're trying to call me to set up an interview. I made it through thousands of candidates and they were down to 10 people they were calling. And I was like, okay. So I pulled over on the side of the road. I had this interview and I get home. I tell my wife, hey, guess who called me on the way home? And, of course we were like, we'll probably never hear from them again. Right. Well, the next week I get another phone call. Hey, we really want to bring you out for an in-person interview. And so I did that they flew me out. I was there, did an interview, got to see a show. They give me the backstage tour, all the stuff. I thought, man, this is freaking cool. Right. And got done. Well, they had 2 more. And so I thought, well, I went from a giant pool to 10 to 3, right? You're like, there's always a chance. So the next day after I got home, they called me and said, hey, we want to offer you the job, but we want to bring your whole family out. And we're going to do. And so they brought my whole family out there, me, my wife, our 2 kids. We flew out there. We were there for 3 days. We went all over the city. They helped us find a house. I mean, it was crazy. And then before we ever, still they had not told me I got the job or offered me the job, right? So we're doing all this. The last day at a dinner, they offered me that job and made the offer. And I called before I got on the plane and accepted the job. So I was the director of, it was information systems for them, for their resident shows division. And so I had all of their permanent shows. So at the time in Las Vegas, the show at the Beau Rivage in Biloxi, Mississippi. So that's what I started with. And so I got there, of course, totally different culture than healthcare, right? Everything is about innovation, but a lot of it's the same because their culture and their philosophy is really about the people that are sitting in those seats. It's not about the show. Their whole philosophy is for 90 minutes, everybody that buys a ticket to go see one of these shows, for 90 minutes, our job is to make you forget everything that's going on in your life. Just 90 minutes. Let your brain forget that I forgot to pay the mortgage and we got to pick up 2 gallons of milk on the way home and little Joey's sick, and forget all that stuff. For 90 minutes at every show, it's an experience that you can literally leave your body and forget everything else. That was every single meeting that I had at Cirque du Soleil. That was our goal. The technologies that we put in, everything that we designed while I was there, everything that we did all around that one experience for every single person that attends one of those shows, whether they're in one of the Las Vegas, one of the permanent shows, or whether they're seeing a traveling show, the same experience across every single show worldwide. And so as I got into that, the innovative part was really cool. We did some really cool things. We developed some amazing systems while I was there. But the biggest thing I learned from that was the culture, and the culture of we know what our position is, right? We know who we are. We really sell nothing. We are selling an experience. That's all that we sell. So how do we do that, and how do we do it well? And the whole culture was around that. For that 90-minute segment, we're going to be the best we can be. Everything's going to be live. Everything's going to be hand generated, hand colored, hand stitched, all of that, because every one of those little minute details is important to somebody in that audience. And so for, a year and a half, 2 years, that was my world in that company. But every single one of these meetings was all about the experience. It wasn't about how big's the auditorium need to be, what's the network going to look like, how many PCs do we have. It wasn't about cybersecurity. It was always about the experience. How do we
Mm.
make this experience the best? And so as I came back to healthcare, that's kind of been my mindset from IT to even to operations. It's always about, we can all say that we're patient centered and we can use all the buzzwords and do all the stuff, but every single meeting here, that's what we talk about too. How do we make this better for the patient? Right? We want to make it better for ourselves. Obviously, it is a business. So the more efficient I can get on this side, the better it is, right? We make more money, which for us goes back in to buy more stuff, upgrade equipment, all those things. But it really starts with, how do we make it better for our patients and really make them feel like they're the most important thing that we have going on at every single spot today. And so we've taken kind of that culture and tried to build it into our culture here. Obviously, where it makes sense. It doesn't make sense everywhere, but for the most part, that is our culture, that we're going to go out of our way to take care of you, and because you are part of our family, we're all in this community, and so we're gonna take care of you. This is how we're gonna do it. So that the whole Cirque du Soleil experience it was phenomenal for me and my family, but it gave me it redirected me a little bit from kind of having the business technology about doing these things to, this is really more important. This is really how you need to do it. This is how we need to approach it. And so now every single project we do, every meeting, that's kind of the way that our culture here at DRH works.
So that's so inspiring. So here you are 24 years later, and you're working on so many solutions now that are maybe, you labeling them consumer grade experiences. And I'm just really curious how you think about that world today, because I've heard people coin the phrase patient access in a lot of ways hadn't changed in 20 years. It's still very dependent on a patient, a provider, a schedule, and then a call center. And I'm just curious your point of view now, having been in this thing with Duncan for, 3/4 of your life, your adult life. How do you see the world today, and what excites you about some of the challenges that you think will inform the next 20 years at Duncan?
So I think the push right now really is around, kind of the consumer tech, right? And how do we reach, kind of like Angie, said earlier, how do we reach the largest number of people in the shortest amount of time? So when I started at Duncan 24 years ago, I mean, we had 3 servers and barely a network, and it's just kind of how it was. You just kind of did what you did, right? And but as everything has evolved over time, we're really into a point now where even in our own organization, I have at least 5 generations of people working here, right? So that generational gap, and as we've all kind of said, hey, you know what, we're gonna live longer and longer and longer, that perspective has changed a lot. So my goal when I first started, when I came to Duncan, our access problem was exactly like you said, right? It was, we got to get a patient in front of a provider, and to do that, we got to get them on a schedule. Well, how do we do it without them calling? I got to call this clinic and that clinic and that clinic. We just want you to call one place, and we should be able to figure out a way to make this work, right? And so we took all that on, trying to make it easier for the patient to have that one-to-one. That's worked for all of us for a number of years. Well, as you fast forward to, let's say 15 years ago, then our organization at the time, like many organizations, 10, 15 years ago, well, now we started taking on other organizations, right? Because now there's this need we've got to grow. You can't survive anymore. It's just kind of the local rural community hospital. You have to get bigger. You have to do more things. There's more expectations. So, so as we started to do that, well, then you really do start to run into kind of access issues because now you may or may not have enough doctors to fill the requirement coming into the call center, right? And having people to be able to do that, to direct other patients that, hey, I don't have a spot here today at 10, but you could drive on the other side of town and I can get you in at 10:15. Even then, it was very, very difficult to be able to align all those schedules and do all those things. Now you fast forward another, you know, set of years, another decade, and everything is done in your hand, right? We all carry a phone. I mean, our phones are more powerful than most of our computers sitting at home. And so all of our kids, our grandkids, that the next wave of, coming through the process, that's how they want to interact. And so we've had to adjust kind of that patient access message to what's not just being able to have enough physicians and providers to care for the people. Now it's really on the consumer side. Well, how do I give you kind of the, for lack of a better term, the Amazon experience or the Google experience where I know I get up this morning and my kid's sick. I can just click two buttons on my phone and I can dial up a provider to talk to them about a fever, or I can schedule an appointment, or I can change an appointment, or whatever the case may be. So the access, kind of patient access experience now is really what the consumer interprets that is. It's not so much what
Mhm.
we're trying to do from the back end. Now it's flipped and it's on the other side. The experience is coming at us, and we're trying to adapt and build tools that make that experience for the consumer better, easier, faster.
Something you mentioned on our call before was that you guys have to compete with all the big dogs as well. So patients are expecting this consumer experience that they're getting everywhere. They're coming miles and miles away from rural places to come see you, but they expect all the bells and whistles that they're seeing everywhere else. And I also imagine even today, people are using ChatGPT to check their symptoms before they even call the doctor's office. That's going to become even crazier as we go forward. So what is that like, trying to make sure that you guys are staying ahead of the game in technology and really serving your patients the right way?
Well, I think it's challenging first,
Mhm.
right? So as a rural organization, I don't have as many people to work. The way that we do things is just usually totally different. Some things for us is real, we can get through them really fast.
Mhm.
So we can do things quicker than the bigger organizations,
Mhm.
but sometimes we also have a lot more barriers. So it blocks a lot of things as we're trying to push those things forward. And in the mindset, again, if we flip to the other side, we know from just our own patient experience that a lot of patients really think bigger is better. That's not always the case, right? I mean, for lots of things, there are pockets where things are better. They just are, right? If the MD Andersons and the John Hopkins and the Mayos, and I mean, incredible organizations, and they have some things that nobody else has. But for most of us, 95% of everything that you're going to need you can get at your local community hospital, and you have good physicians right there. You have good technology. You have all the things that you really need are local. But that perception of bigger is better, so I'm gonna drive 70 miles to Oklahoma City, we fight that a lot. And so to combat that, we really try to promote that we're technically more agile or better than the big guys, or at least to a point equal. So we spend a lot of times educating our own communities, which is a big community. We have 6, 8 counties in southwestern Oklahoma that we cover. So we have three or 400,000 people that we're saying, look, we have all the latest greatest CTs. We can do all the latest nuclear medicine studies. We have a state of the art cancer center where you can be on our linear accelerator and not have to drive 3 hours. We have this technology. And the consumer part of that, though, the things with, hey, I can schedule that on my phone, or I can type something in and send a text message and get an answer back from my provider. I can have a chat with my provider on my phone. Those things kind of set us apart, because for rural communities, a lot of times even though they may go to the city, those technologies are still very difficult, because there's always that factor of time. I've got to drive, or I've got to get somebody to drive me, or I've got to figure out a day I'm going to be off because it's 3 hours up there and I'm going to have a 15-minute appointment and it's 3 hours back. That's a whole day. And so we're trying to, at the same time that we're trying to meet that consumer demand, we're trying to build in the technologies that set us apart from the bigger is better, so that when people start to compare us, on quality and all the other things, we're just as good as they are. But it's the ease of when I can get there. How does it fit in my personal schedule? What does all that look? And so we're trying to be ahead of those guys in choosing the technologies that we have to at least give the community the perception that, okay, well, they might be better, but I can get in here faster, because faster is always the need, right? That seems to be all of our mantras, right? The faster, because I have 187 things I need to do in the next hour. So get me in quick, and I'm willing to, even though they might be a little better, I'm willing to go there. So that's how we're kind of trying to straddle kind of two worlds in the technologies that we're implementing and the technologies that we're building out.
And with that, do you have like a high level roadmap or strategy that you're targeting next? I know you've done a lot of cool stuff with Luma already, but like what's top of mind for you of like what you can innovate next?
I think there's a couple of things. We have 2 hospitals. We have 22 clinics, I think, or something like that now. And then we're still expanding some things. So we have some other opportunities that over the next 6 to 8 months may continue to make us larger. And so one of the things that we're really, really interested in from Luma is right now is kind of the patient queuing. We really like the idea of people being able to, hey, I need to get in and see Dr. Cox, but I send my message in and I can't get in to see Dr. Cox until 2:30. But you know what? We can kind of stack you on a wait list. We can queue you in one of the other clinics. Same thing with our ERs. We're really, really interested in being able to kind of queue people, because we know that everybody worries about that wait time. What's the wait time in the ER? I'm going to go sit for 3 hours with, 75 other sick people that may or may not have what I have in the waiting room. So we really want to be able to kind of work through that to solve just some efficiency problems that we have, especially during some, peak times in some of those places. And then really just from a coordination standpoint, be able to have all of that where our clinic managers can see what's happening across multiple clinics, which, is really kind of in the Luma platform is really, really nice for them. Even with what we've built now, they like the ability that I can go in and I can kind of see multiple things at one time, because we have 3 clinic managers and all the clinics are divided up between them. So, each one has 5, 6, 7 clinics, and they may be spread out all over the place. And so them to be able to see and set metrics on how fast we want to get people in and how many people can be in the wait queue and those kind of things, those are huge. Those are game-changing things for rural America. And so we're building to that point where we can start to stack in, some of those tech functions now.
Hey, Roger, real quick, I have a question on your question. So combining what you had shared with a lot of the bigger health systems and brand, and in many cases, the fact that the bigger the health system, the slower they move. I know that y'all have deployed a portal and that you've looked at portals, and we know the big national players most definitely are going to have the portal of choice from their EHR partner. What led you to the reality that a portal could only deliver so much of what you were needing? And walk us through maybe your vision when you first approached Luma of what you thought you were going to get help with, and ultimately, what did you end up deciding to move forward with? I think for the audience, that's always a question that they struggle with, because name your portal of choice. Many of the EHRs are all loading up, providing more and more capabilities, but we often find that getting the leadership to have the courage to kind of say, that's awesome and it has a great place, but we still need this. Maybe zoom into just that decision point. Where did you start? Where did you end up when you met with Luma? I think that would be interesting to hear about.
Sure. So we're not unique in the whole portal scenario, right? So we have our EHR vendor portal, and we've had that for ever since it was required that we have one. But even then, when we first kind of started the portal journey, we knew that there were going to be some fairly significant challenges to making that work, right? So it doesn't matter whose portal you have, right? And I'm not going to say one's better than the other because really, at the grand scheme, they're all exactly the same. They
Mhm.
all work the same. They basically all have the same functions. It just kind of is what it is, right? And they do have a place, right? So as we've evolved over the last, you know, 10, 15 years with portals, they do have a place that is, that's nice and secure for patients to be able to go pick up my latest lab results or get a copy of my report or whatever. But to log in from a consumer, again, from the consumer side to say, hey, you know what? I'm going to try to do everything I can. I'm going to offer up and I'm going to send out all of your appointment reminders from my portal. You have to go to the portal every time. You have to log in. I have to go through the two-factor thing. I got to do all this work to get in, and then I've got to be able to schedule my appointment. Well, no, the portals really work well from that standpoint because typically what happens is I go in as a patient, I schedule an appointment in the portal, well, it goes to somebody's inbox or it goes to a scheduling queue and it sits there for however long till somebody checks their email. It's not instantaneous, right? And so as we work through, over the last decade, cleaning up our EHRs, making those better, trying to figure out where this portal fits. How do we do all these things? We came to the realization that, hey, you know what? Our portal strategy is kind of done. It just kind of is where it is. I'm not going to rely on that anymore to really use that as a consumer engagement tool because it's just not. As much as anybody wants to try it, it's just not. And so we kind of stepped out of the box and said, you know what? This is a good place, right, to have the portal for people to be able to go pick up their own information. So we're not bombarding medical records or the clinics or whatever the case, but we need a different strategy from the standpoint of true engagement and how do we interact and we do some of these other things faster, cleaner, better that we know we're never going to get to in the portal. And I know never is a really strong word, but I believe it's probably never going to happen in my lifetime. So
Mm.
we really need to step out and try to do some other things. We tried several apps that integrated with our portal. So, on iPhone and Android, and they kind of have a place too, but it doesn't really do the same things. So we went from the portal to the portal in the app, and we tried that for a while. We tried to create our own at one point to try to speed some things up. Well, we're not software designers,
Mhm.
so we've kind of always been looking for what does this really look like, and and then that's where Luma came in. And so our first meeting with Luma was basically, hey, tell me the platform, and I don't want to know all the stuff that everybody else does. Tell me why you're different and how you can help me reach out to this massive population that's spread out over hundreds of miles, and how can your technology help me engage with those people in their palm? That's what I want. How does it work here? Not having to log on, not, having to remember 37 passwords. I want it to go here where I can just do it like this. And I think it caught the team a little off guard, but it was okay. They recovered, Dave. They did great. And so they skipped a bunch of stuff and said, okay, we're not going to really talk about appointment reminders and let's go to this. And so our first meeting was really about the meat of how do you help me solve these problems? Because if you're just going to walk in and tell me I've got all these things, dude, I got 7 vendors back there right now that can do those things. I don't need another one. I need somebody that can help me do these things. After a couple discussions, really it was Luma's like, hey, they have some really cool stuff. They can really help us on this front, and we can take this front and integrate it with the other stuff that we have. Man, that's the big time. You know, we've hit it big. And so that's really what focused us going down that road. And kind of how we got there was that we knew no matter what we do, the portal app strategy just wasn't going to get us where we were. And we were looking for another partner to kind of fill that other gap.
And your patients are responding really well. Like, looking at some initial metrics, like your engagement rate is at 85% across all patients. Like regional already in Luma is about 70%. So you guys are above our average on top of that. So your patients are loving this clearly. And then overall, too, we're seeing like your no-show rate drop over time, quarter over quarter. So I think overall, like all the community initiatives that you guys are doing to educate your community and bring them in and like show them that you're ready to play ball, I feel like is really resonating well. Like your numbers speak for themselves. So that's very exciting to see.
Right. It is, and we hear that from the community. I mean,
Mm.
we have people that tell us all the time, "Hey, that new text thing that you guys do, that's awesome." I mean, yeah, I can't make my CT, my CT exam today, so I mean, yeah, I can reschedule it right there. I mean, the reminders that we have going to everybody's phone. I mean, it's easy. People are used to doing that through, every survey that we all get on our phone. I mean, whatever,
Yeah.
they're used to that, right? And so, I mean, literally, I can sit at dinner and schedule talk to my kids and reschedule their, wellness check for Friday because they just tell me that, oh, well, Friday we're going on a field trip. Okay, well, I can take care of it. That was not possible before without several phone calls or logging in or, doing a bunch of other stuff.
That's so exciting. Roger, as you're thinking about now, moving from first base to second base, because I think first base is communications, reminders. Second base is where you get into rescheduling, wait list, these other more intricate and complicated business problems that you can really make easy for the patient. Talk
Right.
to us a little bit about taking in your role, what I found fascinating talking to you was you spend a good amount of your time thinking about that consumer grade experience, but equally you started thinking about how do I make the lives of the clinic staff? How do I help clinic to clinic work better? I know that you have now started going down a path of looking at how AI can support some of that, whether it's all the document management that is going through your hospitals and the clinics. Maybe we can start there and just tell us a little bit about how you're thinking about addressing faxes. What's your point of view on AI? How do you want that to support RCM so that ultimately, so that you can get on the palm, of your patient, the ability to either schedule themselves or be notified that they're ready to be scheduled? How are you thinking about innovating that fax paper thing into a scheduling event?
For us, that really started with, a really simple example that we have all 100% experienced, right? And I actually experienced it, in our own system with my father-in-law. I had to go take him to an appointment, right? So, okay, we'd go get him. I go to the appointment when he walks in, and what happens at every single exam, right? You go in, you check in, and they hand you at the first of every year, they hand you this giant packet of stuff that you need to update. You know, 19 pages of paper that I got to go through and sit. And I'm with my father-in-law. He doesn't remember half the stuff that's in there. I'm trying to make phone calls. I'm trying to figure it all out, right? We make it through. We get the appointment. Well, okay, he's got to go have a test. Okay, great. We load up in the car. We drive over to our imaging center. I walk into our own imaging center. What's the first thing that happens? I walk up to the desk. Hey, Roger, how you doing? I'm great. Well, you were the father? Yeah. You need to fill out these 19 forms. I'm like, I just filled out the 19 forms, right? It's like, and I know the systems that we have because I've been here a long time. It's like, why am I redoing all of this work? So
Yeah.
we get through that exam, right? So I fill that out. We get through that exam. Well, the next day he's got a PT appointment. So I go pick him up. We go to PT, and that same thing. I walk in and they're like, hey, you got, we need to get these 5 forms. And I actually literally told my director of physical medicine, I was like, Mallory, I just filled out 38 pages of this same stuff at this clinic and at our imaging center. Go find it. I'm not filling it out. I'm done. I'm not doing it. Y'all find it. It's on the system somewhere. And of course, she was like, okay. So, so this all started with this is insanity, right? And in my head, I've been doing this a long time. I knew that's what we were doing. But at that moment in time,
Walking
it
in the
was like,
shoes.
yeah, it was like, hey, you know what? I know everything that we have. Every piece of technology in this or in this entire organization, I know this is nuts. We have to do something better. And so we got a group together. We started talking about, this is the problem. We are going to solve this problem. It may kill everybody on this committee, but we're going to solve it. We're going to do this better because we have to. This is ridiculous. So the first meeting, there was basically the department head of every outpatient clinic, whatever. I said, for this first meeting, if I'm a new patient walking into your clinic, I want you to bring me a copy of every piece of paper that you hand them at that first meeting. I had a stack like this tall of paper. So we went and started laying them all out, trying to match them up. When we got done, I had 4 different consent forms, We only have one in the organization, but we had 4 being used. We had 3 patient packets. It was nuts. And so we decided at that point in time, we got to do this better. We got to unify this. I got to get rid of some of this paper. How do we go about that? And that's really where kind of this e-form kind of fax brainchild started to really kind of happen. And we started doing it with Luma, because what I wanted to do is I now have this documentation committee where we're squeezing down the number of papers. So we now have 1 patient packet that's 3 pages, not 18, 3, that we're starting to roll out across all of our clinics, all of our outpatient departments. But that's just for new patients, right? And then as we get farther deeper into this, it's like, okay, well, patients come in and they're expecting to check in, sit for a couple minutes, go back, right? Which, if you think about it from a restaurant standpoint, they make money turning the tables, right? Well, in our clinics, it's really no different. We need to get people in, we need to get them seen, we need to get them out, because there's always somebody else to kind of, fill in the gap. So the more that we can do that, the more efficient we can, the more people we can see in a day, the more of our family and friends that we can take care of. And so we started looking at that and said, you know what? I want everything that doesn't need a signature or a witness. We're going to create an e-form. And the plan is for every single department, as we go through the organization that has those, we're building those into kind of the AI function with Luma, so that as those things are coming up, or those appointments are coming up, or we're sending out whatever, you also get a text message on your phone that, hey, we need you to go update your information. And so people can do that on their phone. They can do it at home on their tablet. They can go to log in on it. It doesn't matter to me where they do it, but they can do it at their leisure, so that when they do present in the organization, we already have the information, right? So we're not going to be handing you a stack of anything. We're going to expect that it was already done. And if it wasn't, we're building a process in the, on the other side with IT, that we've got, iPads in every location, that, hey, you know what? If you didn't do it, we're going to pull it up for you, and you can run through these things and do them on an iPad, and we'll help you walk through. So, because we do realize there are some people that are still technically challenged. And so that's our solution to help there. But the goal of that is all of that's going to be, all of it's going to be captured electronically. So for our staff, it, excuse me, it really is more efficient, because now our culture is going to be, you go look on the system first before we ever hand anybody a piece of paper or ask them to fill anything out. Go see if it's there, because 99% of the time, it's already done it in there. I just need you to go look. And so we're right now hard pressing on training and how we're going to do that. And, our public relations departments, we've brought them in so they can start, putting a campaign out there with, within the community that, hey, we're only going to be asking for this once. I mean, we're really trying to make this a big deal to streamline all of that paper and get it really down to what everybody expects. Well, if I schedule an appointment and I give you all the information once, I should be done. My information's not going to change, right? Like, unless I move or something. And, in that scenario, we ask every patient anyway, hey, I see you're at this address, and you verify it. Or, hey, we see in your chart, your last surgery was in 2018. Have you had anything else? I mean, that's a whole different conversation with the patient verifying information than it is, I'm going to give you this. I need you to go spend 20 minutes of your life filling it out again, even though you've done it every year for the last 20 that you've been coming here. So we're really trying to focus that and use the technologies to drive those forms and to drive all that based on the appointments that are being scheduled, where they're being scheduled, how they're being scheduled, and tying those together so that your technology picks it up and gets all that stuff out to the right people in an appropriate amount of time where they can do it on their own.
That's great. Angie, you have any questions on that?
No, like this too. Like your patients speak for themselves here. Your
Right.
form completion rate is like 90%. Like our average is 65. And I just remember 10 years ago when I was like trying to convince people patients wanted text messages, and they're like, no, they don't. They want the human touch. And it was like this huge battle every time I talk to people. I'm like, no, please, they want text messaging. But now, no matter how rural you get, we even work with like large Amish populations, for example. They want something to like just help them get the care that they need, and they respond really well to that. I feel like everything that you say, we actually see the numbers to back it up.
I had, it was last week. It's like last Wednesday or Thursday. I had one of our cardiologists called me, and she goes, hey, can you come up to the office? And I was like every COO, when you get that call, you're like, oh, what did we do? What's broken? It's like every bad thing's going through my head as I'm walking across the campus to go get whatever chewing I'm fixing to get in this cardiology office. So I get up there and they're like, "Hey, Roger, how you doing?" I'm like, "I think I'm okay." Yeah, Dr. Mullins, Dr. Mullins, okay, great. She's waiting on you. Perfect. So I go back. Well, she's got a patient in her office. And she was like, "Hey, I want to introduce you to this patient." And so we're talking. The reason that she asked me up there is this guy is a rancher 60 miles from here, literally in the middle of nowhere. He was trying to reschedule an appointment for not only her appointment, he needed to reschedule his appointment because he had a bunch of cattle out and they were trying to get him off the highway. And so he's literally in the middle of nowhere, right? And he had to reschedule an imaging appointment because he was supposed to be over there for an echo an hour later. And the only way this was possible is he did it on horseback on his phone while they were trying to get cattle off the road and it's like, yes, this is our world, I know. But I mean, literally, that's how he did it. And that was
Wow.
at that moment in time, that was so empowering for him that he didn't have to stop what he was doing, which to his livelihood was crazy important,
Yeah.
right? To get his cattle off of the highway before they all got smashed. At that moment, that was important. And it was one of the reasons he said, you know what? I won't ever go anywhere else because of that. I will always remember that. That's big. Those are the things that that we need to be doing with technology in healthcare now. We need to figure out solutions to those kind of problems because those are the problems that matter.
Roger, you were part of there was like 50 of us that did the, build your own agentic, voice solution. I'm just really curious after that experience with us, knowing how much priority you put on the story you just told. How do you think a solution like a navigator or a voice agentic AI solution will be embraced? How do you think it'll be used? What gets you excited about being able to hang that off of just another omni-channel opportunity for you to meet your patients where they're at?
After we did that exercise, which I thought was amazing, that was pretty awesome. I was really trying to think, well, how is this going to fit in and where's it going to fit in? First off, I think it's going to be accepted really, really well. Unlike some of the other things that are out there, even in the the demo model that we were all building our bots in, you couldn't tell it wasn't a real person, right? You couldn't tell that it wasn't somebody that worked here. All the prompts that I put in, were really how we would have relayed that in Southern Oklahoma. So I think it's going to be received very, very well. And from our standpoint, I mean, I think as it goes forward, we're planning on using it for things like callback surveys, right? Or, hey, Mr. Neal, we see you were in the ER yesterday. We, we just wanted to call and check and see how you're doing today, right? And have that go somewhere. So we're really, really excited about multiple ways to use that, from, using it to, if somebody's calling in, I don't really know where I need to go. I just want to know this answer. Great. Let's figure that out. You can call in. It feels like you're having a human interaction, which is always, that human touch that we always want. But it also takes people off the phones for me, right? So I can move those people strategically in the organization to other areas where we really need to spend more time to be better. And bluntly, we all need to be better in this industry. We all have places that we don't have enough people, or we can't spend enough time, or these should be priorities, but they're not. That technology is going to allow me to do some different things to free up people in our clinics, in our outpatient departments, medical records, wherever it is, to be able to take some of these things that should be a priority and elevate them up, because I can remove this layer of workload at the top using the agent.
Well, I know we scheduled an hour. Let's finish with rapid fire. Okay.
Okay.
Pretty simple. If you got to teleport anywhere for dinner tonight, now that you have all this aura, okay, where are you going?
There is a little like street-sided sushi vendor in Tokyo that I've gone to 3 times. Every trip I've made there, I always make sure to go by there, and it is the most fabulous sushi on the planet. And it is literally just a guy kind of in Shibuya Station, which, busiest intersection in the world. He is literally like in a part of an alley with a cart, and it is incredible. I am going every time I'm going there.
I mean, we have more questions, but that's aura. Okay.
Dave loves to drop words his boys teach him, so let's
Hey.
give him the opportunity to do so.
Nice.
And I think your team would be really excited to hear the answers to these questions.
Yeah.
What would your walk-up song at a healthcare conference be?
It would probably be the Be Crazy Train by I just went blank. So, but yeah, Crazy Train.
And if the Duncan team had a mascot, what would it be?
It would 100% be a wolf because they're
Yes.
they're loyal, they're fierce, and they only do teamwork. That's the only way they win is by teamwork.
Loves a
Love it.
wolf.
Yes. I
Last
love.
question.
Yeah.
Oh, go ahead, Dave.
I would just say lions are also good. Same concept.
And then last question, I already know the answer to this. Your favorite show to binge watch?
No, besides Stranger
wow.
Things.
Stranger Things is awesome. I would binge watch that all the time. So I'm going to geek out here a little bit. So probably anything Star Trek or Star Wars. Star Trek is just like, ever since I was a kid, I love every one of those shows. So it doesn't matter. I will just turn it on and watch it for hours.
Well, as the Ewoks kind of move off the screen, okay, we'll let you get back to your day. Roger, this is amazing. I mean, you are a treasure. No joke. I knew, man. I knew after sitting with you that you'd be just a great person to have for the community. So thank you for everything you're doing.
Thank
and
you.
it's such a rich opportunity for everybody else. And I hope you'll be open to talking to us again down the road.
Hey, I would love to anytime. I appreciate the time. And next time I'll remember to dress up. So, yeah.
I'm going to send you one of these Luma sweatshirts.
Send me a Luma sweatshirt. I will wear it.
That was a burn.
I got you.
You're the man,
Hey,
Dave.
I'm on brand.
I like it.
Okay.
Hey,
Be well,
you,
Roger.
thank
Be
you.
well.
Thank you guys. Appreciate it.
Okay. Bye, guys. Take care, Roger.